And Philip Omondi is the sign language interpreter. 7 American aid workers who had been fighting the Ebola outbreak in Congo are quarantining at a new isolation facility in Kenya after the U.S. government introduced new travel restrictions. According to Reuters news agency, the asymptomatic workers who are assisting with the recent outbreak response relocated to the site voluntarily for a 21-day observation period. The matter is at the heart of a legal case in which the High Court ordered the construction work of the isolation facility to be suspended. Satellite imagery, however, shows that the U.S. government went ahead to set up an Ebola quarantine facility at an Air Force base in central Kenya, despite protests and Kenyan court orders blocking it.
When American aid workers are the first people to quarantine at the Laikipia isolation facility, according to Reuters news agency, the aid workers who had been in Congo to fight the Ebola outbreak had voluntarily moved to the facility for a 3-week precautionary monitoring and isolation. A U.S. State Department official was quoted saying Kenyan authorities had authorized their movement into the facility under the observation of the U.S. Public Health Service clinicians, though the decision was taken strictly out of an abundance of caution. The symptomatic workers are said to have arrived at the site in Nanyuki, Laikipia County on Monday and was sleeping in army cots in tents. Some of the aid workers had treated Ebola patients at the Christian aid group's treatment centers in Congo, but others had carried out work such as construction with no direct contact with the sick. NTV contacted Health Cabinet Secretary Aden Duale to comment on the move. Through WhatsApp, he boldly told us to ask Reuters, who had published the story. The Laikipia facility was established by Washington following the mid-May outbreak declaration in the DRC, aligned with President Donald Trump's vow to block any Ebola cases from entering the United States. However, the initiative sparked severe protest, with critics accusing the government of endangering its citizens. The matter ended in the High Court in Nairobi, which blocked plans for the US-operated Ebola quarantine facility. Health Cabinet Secretary Aden Duale announced an immediate halt to the construction of the facility after he was found guilty of contempt of court for failing to observe suspension orders issued by the court against proceeding with the unit.
I have directed the immediate and complete cessation of any intended construction, site preparations, or related activities concerning Laikipia Air Base facility, pending the hearing and determination of the substantive petition or until further orders of this court.
But satellite imagery shows the U.S. government went ahead to set up the 50-bed bio-isolation unit on an Air Force base in Laikipia for asymptomatic Americans exposed to the virus in Congo or Uganda, despite protest and Kenyan court orders blocking it. During a state visit to South Africa in early June, President William Ruto said his government was doing the right thing by allowing the United States to set up an Ebola quarantine facility in Kenya.
One of the facilities that has now raised a bit of controversy is the facility we agreed to set up in conjunction with the Americans in one of our military air bases. And why have we done that? We have a huge American military contingent in Kenya, number one. Number two, we have set up the 23 other isolation places in Kenya with the support of friends, among them the Americans, our own resources, but also with the support of Americans. The debate is, are we doing the right thing? Are we not? And I can tell you without fear of any contradiction, and I can look at everybody in the eye, Kenyan, including yourself, and tell you we are doing the right thing.
The number of confirmed Ebola cases in the DRC increased to 2,124 on Thursday, including 828 deaths, according to government data. The World Health Organization, WHO, has warned that Ebola is spreading in Congo more quickly than in any previous outbreak. Rozongoi, NTV.
Now, what do a